Hello, thanks very much for your question. So this is how do you get tested for EDS? I don't know who to talk to. So for anyone who doesn't know, EDS stands for Ehlers-Danlos syndrome, and it is a connective tissue disorder. So your body doesn't produce enough collagen, and the collagen it does produce is faulty. Collagen is a sticky connective tissue protein that holds you and your organs together. So you are like this inside and out basically, which leads to problems. So first place to start when it comes to Ehlers-Danlos syndrome is your GP. Now GPs have been given an EDS diagnostic hand guide to help diagnose patients. However, some doctors prefer not to use it and refer you. It just depends on your GP, their capabilities and what they feel comfortable with. Some doctors will use the hand guide, they'll go through the assessment, they will then write off to places like rheumatology or genetics and say, I have this patient, can you give me advice and guidance on what to do? Do I diagnose? Is this correct? And then they will get a response from whoever they've written to with yes or no, or just kind of general advice for the doctor. But your GP can, so the best place to start would be your doctor. Explain that you think you've got Ehlers-Danlos syndrome, these are your symptoms, can you pursue a diagnosis? The second place will be rheumatology, although rheumatology have become a bit funny about seeing EDS patients. They're like, well, we can't help, so what's the point? What a load of rubbish. I was diagnosed in 2019 by a consultant rheumatologist who specialised in connective tissue disorder. And then the third person would be a genetics specialist. Now you can be referred to the NHS for genetics for very strict criteria. One of them is suspicion of things like vascular Ehlers-Danlos syndrome, which have very physical kind of obvious characteristics. When they're diagnosed, they'll go through something called the Brighton scale, which is the diagnostic criteria for hypermobile Ehlers-Danlos syndrome. That has 3 sections. You have section A, B and C, and within those you have sub-criteria, which you have to meet certain aspects of in order to be diagnosed. That is the only test I have ever excelled on, basically, which is actually really sad. The Brighton scale can also be accessed offline as well, so if you type in EDS Brighton scale, I'm pretty sure EDS UK have a copy of that or information on that on their website. One thing I'd like to point out is everyone assumes that with Ehlers-Danlos syndrome you have to have severe hypermobility. That is not the case. It's important to remember the older you get, so from between childhood and adulthood, you become less flexible, which is why the amount of flexibility you need to be diagnosed does reduce as you get older. I have friends who have Ehlers-Danlos syndrome who aren't actually hypermobile. We've only got 2 hypermobile joints. They've been diagnosed by genetics. So they have hypermobile Ehlers-Danlos syndrome, but they're not excessively hypermobile. So it's really important to remember that it's very much individual to the person. So the people you need to speak to, as I've said, would be your GP as a first port of call if they don't feel comfortable, rheumatology or genetics. Also, they could, privately can be diagnosed as well. So private rheumatologist, private geneticist, and maybe a private GP, depending on, what they do. Yes, that as far as I'm concerned, that is it. It was a while since I was diagnosed, so I hope I've got the information correct. If anything has changed, please pop it in the comment. That could be really helpful. And yeah, good luck, Chloe. I'm sending you lots of good vibes and spoons. Bye!